how do we manage to slow down the rate of infection? Dr. Gertie Anyanwoke, an infectious disease specialist and medical doctor at Baton Rouge Multi-Specialty Care Center, Louisiana, U.S., joins us via Skype. Thank you for joining us on the program.
Thank you. Thank you for having me.
What's your assessment of the coronavirus in Nigeria? Do you think that the numbers being reported might actually be higher or less? And that is considering the spike we're seeing in states perhaps like Kano, which speaks to previously undetected cases spreading.
Well, as you know, all over the world, testing has been a major issue. And so if you don't test that much, you may not find as many positives as you could. I know that NCDC is doing their best, and I belong to the Association of Nigerian Physicians in Americas, AMPA, and I know that we are willing to see how we can assist with any recommendations in addition to what is already being done in Nigeria. But we are aware that the Federal Ministry of Health and NCDC are trying their best in terms of testing. But like you know, it's been challenging world over being able to get the PCR testing for the virus.
Dr. Anyanwoke, you've treated some COVID-19 patients. Tell us your experience. It's
been a lot of good experiences, some not so good, especially when I lose a patient, but overwhelmingly, most of the patients have done well. I have to reiterate that majority of people that test positive may have no symptoms or very mild symptoms, and this is about 81% as we know it at this time. And so the people that are sicker are the people that we usually admit. My patients that I manage at home depends on their level of severity. I could call them, say, every day or two to check on them. They stay at home on self-quarantine. The patients that I admit in the hospital is another matter. A lot of times they are more severe, some of them requiring intubation, ventilation, oxygenation on the machine. And then that's where it's like a multidisciplinary approach. But first of all, even the patients I have at home, if they have some coughing, inflammation, maybe even mild pneumonia, I put them on antibiotics. I have a personal concoction of multivitamin, vitamin C, and some zinc. I have used hydroxychloroquine for the patients that I've admitted in the hospital, and that's because we don't have much else to go. But my patients that are not hospitalized, I don't usually place on hydroxychloroquine because majority of them have done well and without hydroxychloroquine. Some of them have risk factors, especially cardiac risk factors, and so I wouldn't want to jeopardize them that way. The patients that I admit in the hospital, if they don't have those risk factors, I put them on hydroxychloroquine because we don't have anything better. However, there has been a study that was partially released this week of remdesivir, and it seems promising. We're going to be looking into that and see if that can help our patients further.
All right, while we wait for the World Health Organization and the vaccines, we'd like to thank you, Dr. Gertie Anyanwoke, an infectious disease expert. Thank you for joining us on the program.
Thank you so much for having me.